Hey everybody, this is Dr. Peebler again. We're going to be going through some epidemiology today, in particular regarding sun exposure, UV exposure. Now, I'm sure that you probably have noticed the same, but it seems as if the powers that be in all areas of government and media want us to be absolutely terrified of going outside and getting your skin exposed to the sunlight. Basically made to feel that if you are outside for more than 5 minutes without SPF 1000 or having a lot of clothes on, big hats, etc., you're going to be headed to the morgue pretty quickly because you're going to die of metastatic melanoma. And I don't want to insert my own opinions into this. We're going to look at data. Okay. And so I think most of us have seen, ads like this. This is from the National Cancer Institute. People of all ages and skin tones should limit the amount of time they spend in the sun, especially between mid-morning and late afternoon. What they're referring to is when the UV index is high, right? So that's when we're able to actually make vitamin D in our skin. And I'll explain that in gruesome detail at some point in this series, and avoid other sources of UV radiation. This is from the CDC, telling us to be careful in the sun. This is from the World Health Organization, telling us about an app to help protect you from the dangers of the sun, and promote public health. Promotes public health, they say. And you name it. This is from Family Doctors. This is from the American Academy of Family Physicians. Articles about protecting you from the sun. American Academy of Dermatology, sun damage in your skin. And then American Academy of Ophthalmology, asking you what your risk is of eye damage from UV light. Then you have, big companies like S.C. Johnson, who has full-page ads about how dangerous UV is. Did you know that UV is carcinogen, not related to temperature, can pass through clothing? I mean, it's just like the boogeyman. Then they, down a couple swipes down, and you have all the products that are willing to sell you and protect you from this dangerous light in the sky. Publish articles, with catchy titles about sun dangers, from whether it be from the British Dental Journal. Not sure why they're worried about that, but the Professional Nurses Journal, Pediatric Nursing, etc. All these articles about the dangers of the sun, whether it be your kids out, in the summer trying to get tan, or whether it's your kids playing sports and how to protect them. Then there's the mainstream media, who's telling us, protect yourself from the dangers of the sun. Tanning alternatives, savvy about sun dangers. That could be local news, that could be national news, international news, warning against the dangers of the sun exposure, blocking sun's rays. The Senate apparently was at one point, I guess this year, 3/2/23, saying that they want to block the sun's rays, and they find support in the Senate. I'll digress. Basically, you're basically hit from every angle possible, warning you how dangerous the sun is. Well, what does the data actually show? Oh, here's one. I'm a skin expert. I beg you not to make dangerous tanning mistakes for your summer holidays. Okay. Well, let's see what the data shows. Okay. So this is from the CDC. This is the most recent data that I could find from 2019. And it showed that of all causes of mortality, there were 2.183 million deaths in the United States. And of those diseases that people die of, roughly 24% are heart disease, 21% is cancer. And we're going to dive into the cancer statistics in particular to dispel the myths around cancer in the sun. And then there's, 7.6% is unintentional injuries. We have strokes, diabetes, Alzheimer's disease, suicides, etc. Right? So hundreds of thousands of deaths from these other things, right? That we all see, that our friends and family and, for healthcare providers, patients have. These are things we always see in the hospital. Then I wanted to dive in. This is also from the CDC. So what are the leading causes of death from cancer in 2020? So it looks like the leading causes of cancer death are from, see here, lung cancer is the leading cause of death at 23% of all cancer deaths. The other causes are colon and rectal cancer, 9%, pancreatic cancer, 8%, female breast, 7%, prostate cancer, 5%, liver and intrahepatic biliary duct cancers, 5%, and then all other cancers are less than 5% of deaths. So I actually added it up, and then just roughly I added these numbers up, and it looks like about of the top 1, 2, 3, 4, 5, 6 cancers, although there's probably several within liver and intrahepatic duct. There's obviously several different types of lung cancers and colorectal cancers. But bottom line is the top, 1, 2, 3, 4, 5, 6 cancer types, subtypes, that ends up being 338,000 deaths. Again, roughly, I didn't do exact numbers. And I extrapolated to the most recent CDC data we had, which is 461,000 roughly deaths from cancer in 2019. And that means that the top 6 cancers are 73% of all cancer types. Now, what you're not going to see on this graph of, and it's going to be in the other less than 5% of all cancer deaths, is melanoma, malignant melanoma. I can tell you as a hospitalist, I've worked at more than 20 different hospitals. I have rarely seen people, I mean, we're talking rarely see. And I understand I don't work at, the NIH or Johns Hopkins or anything like that. So, maybe it's possible that these, horrible incidents of metastatic melanoma and melanoma are at these big tertiary centers. So it's possible that, me working in community hospitals, I feel like I have a pretty good understanding of the incidence of these things just because I've worked in about 8 different states, 20 different hospitals over the last 6 years. I have rarely seen anybody have metastatic melanoma. I'm not saying I've never seen it. I'm just saying it's rare. But however, lung cancer, colorectal cancer, pancreatic cancer, breast cancer, prostate cancer, I see all the time. And I'm going to try to explain why I think that's important. So the things that we should actually be worried about, in terms of incidence of things that can actually kill you are these. And so let's go down here. So the financial burden of cancer, according to the NIH, in 2015 was $190 billion we spent on cancer, and they estimated it's at basically 209 billion by 2020. Now I don't have those numbers, unfortunately, but I'll bet you it exceeds that. And then this is from Penn State. This is saying for the top 15 prevalent types of cancer, we spend approximately 156 billion in 2018. So as you can see, we spend the vast majority of the money on the most prevalent cancers, which makes sense because they're the ones that are affecting human health, right? So interestingly enough, there's actually a pretty well-known therapy that we use in medicine, not me personally, but medicine in general, is something called phototherapy. And in 2021, the global phototherapy market was valued at nearly $400 million a year, with an annual growth rate of 4.8% forecasted per year. And so phototherapy is using light therapy. I'm going to move my little picture out of the way so we can actually read this. Having unsuccessful here, but bottom line, it's using UV light to treat conditions such as skin conditions such as eczema, vitiligo, and severe psoriasis. They also want to expand using phototherapy to help with wrinkles, skin cancer, dementia, and other skin conditions. So tell me how much sense it makes for me as the doctor to have you avoid the sun to protect yourself from wrinkles, skin conditions, skin cancer, etc., when we're using that therapy without the natural spectrum, which we're going to talk about also in depth. We're talking about unopposed UVA or UVB radiation via a fake light, and we're making $400 million a year out of it, but yet we're having ads and media ads like we've looked at above ahead saying the dangers of sun. So help make sense. So I'm going to go through several different studies. They're all going to be on different health conditions. So this one is called Sunlight and Vitamin D, and this is from Dermatoendocrinology, 2013. And it says, as a result of 1,25-hydroxy-D influences a large number of biologic pathways, which may help explain associations relating vitamin D deficiency, living in higher latitudes, less sun, with increased risk for chronic diseases, including autoimmune diseases, cancers, cardiovascular disease, infectious disease, schizophrenia, and type 2 diabetes. Another study from Med Hypothesis, 2016, there is a growing observational experimental evidence that regular exposure to sunlight contributes to the prevention of colon, breast, prostate, non-Hodgkin's lymphoma, multiple sclerosis, hypertension, diabetes. Initially, these benefits were ascribed to vitamin D. However, recently it's become evident that immunomodulation, the formation of nitric oxide, melatonin, serotonin, and the effect of sunlight on circadian clocks are also involved. So as we looked at the top killers of cancer in the United States, at least, according to the CDC, is colon, breast, prostate, pancreatic, intrahepatic, and ductal cancer and colon cancer. And it's been shown, at least in this very 20,000-foot view, that sunlight, regular sun exposure, contributes to the prevention of those things. This is another, I thought this was a mind-blowing study. This is from the International Journal of Environmental Public Health, 2020. Studies in the past decade indicate that insufficient sun exposure may be responsible for 340,000 deaths in the United States, 480,000 deaths in Europe per year, and an increased incidence of breast cancer, colorectal cancer, hypertension, cardiovascular disease, metabolic syndrome, multiple sclerosis, Alzheimer's disease, autism, asthma, type 1 diabetes, and myopia. So pretty powerful. Lots of excess deaths due to insufficient sun exposure. So why is every article that you see about the sun telling you how to protect yourself against it? I don't know. How about this? Associations of sunlight and UV with blood pressure and cardiovascular disease. How whole body UVA, that's one portion of the UV spectrum. Irradiation lowers systemic blood pressure by release of nitric oxide. UV light may contribute to geographic and racial blood pressure differences. As you can see here, based off of these graphs, the closer you get to the equator, the lower your blood pressure is, both systolic and diastolic. And then the prevalence of hypertension also lowers as we get closer to the equator. UVA irradiation of human skin vasodilates arterial vasculature and lowers blood pressure independently of nitric oxide synthase, which means there's multiple mechanisms of how blood pressure is lowered besides nitric oxide. Nitric oxide is one of those chemicals that can vasodilate or lower your blood pressure. Seasonality of cardiovascular disease mortality and the possible protective effect of ultraviolet radiation. So basically showing that in different seasons of the year, there's less cardiovascular disease, and they think that UV radiation, the thing that we're supposed to be so scared of, the dangerous part of the sun, is actually causing that effect. This is a graph showing that basically the higher your vitamin D level is, which is associated with higher amounts of UV radiation on your skin, particularly UVB, which we're going to talk about later, has lower all-cause mortality as well as cardiovascular mortality. As you can see, it's a fairly linear curve down. Association between UVB and vitamin D status, as well as type 1 diabetes. As you can see, the latitude, as it gets further, it's almost next to nothing. You see incidences, and then the higher the latitude, it goes parabolically higher, as high as 30. Actually, it looks like in Finland, as high as 40% incidence per 100,000. Short-term and long-term sunlight radiation and stroke incidence. So basically lower stroke incidence due to sun exposure. In this study in 2012, it looks like we observed an increased risk of ischemic stroke of 82%, 82% increased risk of stroke if your vitamin D levels are lower than the 5th percentile compared to those who had levels above the 50th percentile. Again, and to be honest with you, the numbers for vitamin D for the conventional medicine is sickeningly low. So it means that you have to have a exceedingly low vitamin D level to have that low of a vitamin D status to be the 5th percentile. Sunlight, basically the median sunlight exposure, if you were below the median sunlight exposure, you had a 60% increased stroke risk. COVID mortality. Sunlight fatality latitudes, sunlight vitamin D, a highly significant positive correlation was found between lower deaths rate and a country's proximity to the equator. Influenza, same thing. The data support the hypothesis that vitamin D level, high vitamin D level, as found in the summer, acts in a protective manner in respects to influenza as well as pneumonia. Psoriasis, as you can see, the 0 latitude from -23 south to 0 is the lowest incidence. The further you are south, away from the equator, it gets higher, and then the further you get north away from the equator, it exponentially starts to go up of psoriasis. Another graph showing, basically the amount of UV radiation a person gets. I think this is lifetime, if I'm not mistaken. But our findings suggest that populations in countries with higher UV radiation exposure present a lower prevalence of the disease with psoriasis. It can be debilitating for some people with skin disease. And then interestingly enough, advances in phototherapy. Remember that phototherapy, the thing that the mainstream medicine is making, $400 million a year on, to give you fake UVB and UVA, is showing efficacy and safety, and represents the gold standard for treating psoriasis and atopic dermatitis. Gold standard, but avoid the sun. This is another one, efficacy of localized phototherapy, photodynamic therapy for psoriasis systemic review. The pooled effect estimate of a 75% reduction in severity. Topical PUVA, targeted UVB, PDT were as follows: 77% topical PUVA, 61% reduction for UVB, and 22% for PDT. So as you can see, mainstream medicine has no problem using UV, but then tells you to avoid the sun. This is looking at past exposure to sun, skin phenotype, and risk of multiple sclerosis or MS. So higher sun exposure when aged 6 to 15 years, average 2 to 3 hours or more a day in the summer during the weekends and holidays, was associated with decreased risk of multiple sclerosis. Decreases your risk by, it looks like 69%. Higher exposure in the winter seemed to be more important than higher exposure in the summer, according to this study. As you can see, this is a prevalence of MS given your latitude. As you can see, the higher the latitude, the further away from the equator, the exponential rise in cases of multiple sclerosis. This is another name for multiple sclerosis. Autoimmune encephalomyelitis is independent of vitamin D. So basically what it says is that these results suggest that ultraviolet radiation is likely suppressing disease independent of vitamin D production, and that vitamin D supplementation alone may not replace the ability of sunlight to reduce MS susceptibility. So I think that for a lot of my mainstream colleagues, we think that, the only benefit you can really get from sunlight is vitamin D. I'm going to show in exceedingly grave detail later on in this series that there are many benefits to sunlight besides vitamin D. But vitamin D is a very important one, and that basically that vitamin D supplementation alone will not replace the ability of sunlight to reduce the susceptibility to these diseases, especially in this case, MS. Ultraviolet B radiation and the risk of developing rheumatoid arthritis, very common autoimmune arthritis that people can get. Among the nurses' health study participants, higher cumulative average UVB exposure were associated with decreased RA risk. Those who had the highest versus lowest category had a 21% decreased RA risk. UVB was not associated with RA risk among younger women, according to the study. So as you can see, this is pretty cool. The incidence of having this disease process seems to be lower with latitudes in the United States based off the color coding. This is a study showing the higher sun exposure is associated with lower risk of pediatric inflammatory bowel disease. That would be like ulcerative colitis or Crohn's disease. Can be horrible, horribly detrimental, several surgeries, complications upon complications, repeated small bowel obstructions, inability to digest nutrients, and just a miserable quality of life. So higher sun exposure is associated with that. You can see the graphs, it's a linear exposure. The more sun exposure you get, the lower your odds ratio are of getting these things, in particular, in this case, pediatric inflammatory bowel disease. Another study showing a very similar thing in the article in 2012 by the magazine, or the article called Gut. Geographic variation of incidence of inflammatory bowel disease among U.S. women. This conclusion came to that in a population of U.S. women, increasing latitude of residence was associated with a higher incidence of Crohn's disease and ulcerative colitis. That's what CD and UC stands for. And in this particular graph, it just shows that the further you are from the equator, again, with this pathology as well, basically you have a linear incidence of UC and CD, as you can see, ulcerative colitis and Crohn's disease. Northern latitude, but not season, is associated with increased risk of hospitalizations related to inflammatory bowel disease. So not just having inflammatory bowel disease, but actually the severity and how often you're hospitalized. This says that UV index was significantly inversed, associated, although not proportionally to discharge rates for Crohn's disease and ulcerative colitis. Conclusion: in the U.S., there is a significant increased risk of IBD, inflammatory bowel disease, related hospitalizations in northern compared to southern states, which is not fully explained by differences in UV exposure, probably because there's more benefits to the sun besides UV, which we're also going to go over. Narrowband UV, this is just, again, looking at UV only, not the whole sun, but UV in the B range improves mood for people with depression. In conclusion, our pilot study showed that narrowband UVB exposure improved mood, especially those with evening preference in their daily activities, as well as circulating vitamin D3 levels, as well as decreased IL-6 levels, which is an inflammatory biomarker. Just having high inflammation can increase your risk for depression. I can show you the mechanism behind that. Effect of ultraviolet light on mood disorders and well-being. Of the 7 studies, 6 demonstrated benefit of exposure to ultraviolet radiation and improvement in mood, which supports the positive effect of ultraviolet light on mood. This is talking about the latitude with developing schizophrenia. Our findings suggest there may be a relationship between the lack of exposure to sunlight and increased risk of hospitalization admissions for schizophrenia. So not just depression, but also other serious psychiatric diseases such as schizophrenia. This is another study looking at sunlight and cognitive function. This is a study found the association between decreased exposure to sunlight and increased probability of cognitive impairment, aka mild cognitive impairment or Alzheimer's disease, dementia. Geographic variation in dementia in various countries, looking at the latitude, vitamin D, air pollution, dementia. Standardized mortality ratios were higher in northern and central versus southern Italy. The inverse pattern was seen in New Zealand. Now, New Zealand's in the southern hemisphere, so that's why it makes it inverse. That basically, the closer you are to the equator, the lower risks you have of developing dementia mortality. This is another study, fairly new, 2022, from the British Medical, that says that the Cox regression model showed a marked increase. This is showing a 28%, round up 29% increase if you have a low sun exposure of developing dementia, but the relative slow increase at higher exposure. So basically, if you have a high exposure, you're basically about 20% less of having dementia. Results are more pronounced among participants that are over 60 years old, females, and those who had exactly 7 hours of sleep. Interesting. We can probably explain that from several different mechanisms, including melatonin production. Then there's another pretty cool term I've heard recently. It's called heliovaccination. So basically, it's showing that exposure to UV via the sunlight acts as a vaccine against cancer. It basically entrains your immune system to learn how to find cancer and destroy it more effectively. Now, that's pretty cool in a test tube, but what about like real life? So they found that there's a relationship between low UVB radiation, aka the strong UVB portion that makes vitamin D, and higher incidence of breast cancer in 107 different countries. And another one with UVB exposure to cancer. So this first one shows increasing increments of UV of vitamin D in the range above 22 nanograms per milliliter, which is very deficient. Basically, you have to be very deficient to be at 22 nanograms per milliliter. Have I seen people in single digits? Yes, but you have to be very adverse to being in the sunlight or taking any supplementation to get that to that level. So this is a person who is deficient, and as soon as you start to increase it, you have an incrementally lower incidence of breast cancer. According to multiple regression, UVB irradiance adjusted for cloud cover was inversely associated with incident rates. So basically, the more UVB you have with less clouds, the less breast cancer you have. This other study we showed here next to it, these findings provide strong evidence that vitamin D status plays an important role for controlling the outcome of cancer, supporting that UVB vitamin D cancer theory is now scientifically strong enough to warrant the use of vitamin D in cancer prevention, as well as a component of treatment. So this is pretty old data. This is from 1908 to 2012, or I mean 1912, excuse me. And it's looking at mortality from cancer, and this is old data. But as you can see here, the closer you get to the equator, so let's say here, rate of death per 100,000 at 60 degrees north to 50 degrees north is 105. As you can see, you get towards the 0 degree, 10 north to 10 south, you're at 11. So you're at a 10-fold decrease in cancer death. And then the further you get south, away from the equator, it starts to shoot up again. This is kind of a similar graph looking at the United States in the solar radiation index versus cancer mortality. As you can see, the more solar radiation you get, the less chance of dying from cancer. This is all forms of cancer. This one's particularly looking at colon cancer. The more solar radiation you get, the less chance of dying from colon cancer there is. This is another study. This is looking at ultraviolet radiation and breast cancer in particular. We found their correlation between exposure to UV radiation and breast cancer, a relative risk of a 0.70, which is about a 30% risk reduction. And we also found a linear dose response. So basically, the more you got associated radiation, or as you can see on the right, as your time and hours of ultraviolet goes up, the relative risk starts to dramatically go down for breast cancer for women age over 40. This is an estimate of premature cancer mortality due to inadequate doses of solar UVB. So what this is saying is there's an annual number of premature deaths from cancer due to low UVB exposures was 21,700. For white Americans, 1,400 premature deaths from cancer for Black Americans, and 500 premature deaths from Asian and other minorities. And you can see the mortality starkly goes down with increasing UVB exposure. This is a study showing the lower risk of lymphoma with greater sun exposure and higher altitude. That's another way of measuring, basically the closer you are to the equator and the higher your altitude, the higher, the stronger the sun is basically. So greater sunlight exposure and higher altitudes are simultaneously associated with lower risks of Hodgkin's lymphoma and non-Hodgkin's lymphoma. UV radiation and cancer prevalence. What is the evidence? The health benefits of sun appear to outweigh the risk of skin cancer. That's I think at this point needless to say. So I want to kind of tear down the sacred cow of melanoma and exposure to the sun, right? So I pulled a bunch of studies, and it's just going to kind of hopefully just demystify the fear around going outside and exposing your skin to the sun. So this study in particular, relationship between sun exposure, melanoma risk for skin tumors in different body sites, and large case control studies in a temperate climate. So this is they found an overall protective effect of regular weekend sun exposure was seen, particularly for limb tumors, which could be mediated by photoadaptation or higher vitamin D levels. The mechanism at this point, I wouldn't worry so much about. We're going to discuss that in detail, how like all the different mechanisms of how the sun is protective against different diseases through mitochondrial redox. But needless to say, this is just a high level, okay, of looking at how these things, how the sun protects you. So melanoma skin exposure, the overall data from published studies, overall, there was a significantly positive association, odds ratio of 1.71 for intermittent exposure, significantly reduced for heavy occupational exposures. So what it's saying is that you have actually, according to this meta-analysis, you actually have a 14% decreased risk if you have heavy exposure to melanoma. and a marginally significant increased risk for total exposure. So it's kind of a confusing way of saying that if you just kind of every once in a while go outside and get some sun, you actually have an increased risk because you're more likely going to be burned. The big problem with the sun is being burned, and not going slow and developing what one of my mentors calls a solar callus, which is the amount of eumelanin in your skin in particular, which is your body's sunscreen. There's other sunscreens like that we'll talk about later, but melanin is one of the most important ones. And so basically, if you get outside every once in a while and burn yourself and stuff like that, you're going to have increased risk for melanoma. But if you have heavy occupational or regular heavy exposure that doesn't burn you, you actually have a decreased risk of melanoma, skin cancer. There's another study that was, it's pretty wildly controversial title here. Melanoma is not caused by sunlight. And in this study's opinion, when comparison is made for cutaneous melanoma with cutaneous squamous cell cancer and basal cell cancer of the skin with respect to age dependent, sex ratio, distribution of the body, association with sun exposure, and variation of latitude, it is clear that squamous cell carcinoma is due almost entirely to sun exposure, that basal cell carcinoma potentially is partially due to sun exposure, and that melanoma is not due to sun exposure. So we're going to try to help make sense of how this, how to kind of dissect this. So this is a prognostic value of vitamin D serum levels and cutaneous melanoma. Now, let's not forget, we're going to go into detail about how this happens, but vitamin D basically it's a proxy for how much sun you get, right? So your body makes vitamin D via being exposed to UV light. So it's saying a prognostic value of vitamin D serum levels in cutaneous melanoma. So if you have vitamin D levels less than 9 nanograms per milliliter associated with ulceration of melanoma and serve as an independent prognostic factor for overall disease. So basically, the higher your vitamin D level is, the better prognosis you have of having melanoma and the severity of melanoma, right? So again, more sun exposure, more vitamin D, less severe and better prognostic factors of melanoma. It kind of seems like the opposite of what you're being told. Vitamin D and melanoma, cancer risk and prognosis. Again, I'm having to kind of like guess what these titles are because my face is in the middle of this. But bottom line is, the summative relative risks and random effects models for the association highest versus lowest vitamin D serum status was 1.46 and 1.64 for cutaneous melanoma and non-melanoma skin cancer, respectively. The summary relative risk is the highest versus lowest quintile for vitamin D intake was 0.86. So if you have the highest amount of vitamin D quintile, again, this kind of goes along with that other study, you have about a 14% decreased risk of cutaneous melanoma and about a 3% increased risk of these non-melanoma skin cancers, which if we look again at the cancer deaths and deaths of all types of mortality in the United States, we're talking less than 5% of deaths from cancer is somewhere in there is skin cancer. There's all kinds of other different cancers that is also in there that is, we're talking like probably less than 1% of cancer deaths are from skin cancer. Yet we're telling people to stay out of the sun. And as a matter of fact, the more sun you get, the better you are in terms of prognosis and if you actually develop a skin cancer and your survival. Sunlight, vitamin D, and malignant melanoma and update. So it found this study found it has to be emphasized that in contrast to intermittent, short-term, high-dose solar exposure, basically getting outside and getting fried every once in a while, more chronic, less intense exposure, which is recommended by many experts in the field to obtain sufficient vitamin D status, has not been found to be a risk factor for the development of melanoma, and in fact has been found in several studies to be protective. Again, where is the mainstream media? Where is the NIH and the CDC, shouting this kind of stuff? It's not. You have to search for this data. And it's actually pretty sad because there's a lot of studies showing kind of similar things. Vitamin D deficiency in melanoma patients is associated with worse overall survival. So basically, the less sun you get and the less vitamin D you have, the worse you do with melanoma. Help me make that make sense, given the standard paradigm of the dangers of the sun. and protecting yourself from this horrible light in the sky. Vitamin D deficiency at melanoma diagnosis. So once let's say hypothetically, you get diagnosed with melanoma, your vitamin D deficiency is going to be associated with higher Breslow thickness, which is basically what really matters for prognosis for mortality with melanoma. So if your vitamin D status is less than 50 nanomoles per liter, which is the way the Europeans do it, not us, we use nanograms per milliliter, is associated with a nearly 400% increase of having a thicker tumor, which is an odds ratio of 380% increased risk of having basically a more severe tumor. Pretty staggering, really. Vitamin D deficiency is associated with prognosis of metastatic melanoma. A worse melanoma prognosis is associated with vitamin D deficiency, higher stage, ulceration, and higher mitotic rate. 200% increase in those things. In patients with stage 4 metastatic melanoma, stage 4, it's all over your body. Vitamin D deficiency is associated with significantly worse melanoma specific mortality, 200% increased mortality with vitamin D deficiency, aka sun deficiency with melanoma. Patients with metastatic melanoma who were initially vitamin D deficient and subsequently had a decrease, or basically less than 20 nanograms per milliliter, which is very low, there had significantly worse outcomes, 468% worse outcomes compared to those who had greater than 20, and 20 is low. I mean, 30 is considered deficient. For us and in our business in functional and integrative medicine, generally we want it 60 to 80. I mean, sometimes if you have cancer, we want to push it to 100, 120, because as you can see, I mean, it's drastically higher if it just goes from less than 20 to above 20. So it doesn't make sense, right? Severe vitamin D deficiency associated with BRAF mutated melanoma. Overall, 104 patients, 84% were vitamin D deficient, 32 of which, 31% were severely deficient. This is at time of diagnosis. 4 patients were classified as stage 0, 3%. 18 patients were stage 1. 7 were stage 2. 16 were stage 3, and 79 were stage 4. Basically, at time of diagnosis, people with stage 4 melanoma had either deficiency or severe deficiency of vitamin D, which means they're having no sun exposure or very little sun exposure. Vitamin D and skin cancer, an epidemiologic patient-centered update of the review. This is from 2021. Misnamed vitamin D. Vitamin D is a true hormone that humans can synthesize upon sun exposure or through balanced and healthy diet. I'd say that's very difficult, if you want me to be honest with you, but we'll read the article. However, our current predominant indoor lifestyle with unhealthy, intense, and sporadic sun exposure, along with other factors such as human migratory movements, have contributed to the vitamin D deficiency epidemic. Paradoxically, this epidemic is accompanied by an increase in endemic skin cancer. So what they're saying is, because we're not in the sun and we're inside, and if we do get sun, it's sporadic and burning ourselves to a crisp, we have an increased risk of skin cancer, which is the exact opposite of what we saw in all those articles, whether it be from government sources, whether it be from international bodies, medical bodies, or whether it be from media sources. Exponentially increasing incidence of cutaneous melanoma in Europe correlate with low personal UV annual doses, suggest 2 major risk factors. So this is basically looking at over the time, the greater, unfortunately, Europe is not at an equatorial level, but they're looking at the higher your latitude is, the cutaneous melanoma cases per 100,000 increase. So what it's saying is that, and as you can see, as the UV exposure, this is measured in joules per meter squared, increases, it also decreases your cases of melanoma. Absolutely stunning. So moreover, we uncovered yet another paradox. The increasing cutaneous melanoma incidence significantly correlate with decreasing personal UV dose, a proxy for low vitamin D levels, as we've talked about. We also discovered the incidence of cutaneous melanoma, malignant melanoma, significantly increases with decreased personal UV dose from 1960, when it was almost insignificant, to 2000. Basically, it's completely, the literature here, and hopefully I'm doing a good job here, is completely debunking the idea that sun exposure, unprotected sun exposure, increases your risk for skin cancer. As a matter of fact, it decreases your risk if you're smart about it, and it decreases your risk for all kinds of other things that you don't want to have. So I'm not saying the sun cannot be dangerous. I'm not saying that at all. I mean, water can be dangerous. If I drink 2 gallons of water, I can cause, possibly deadly hyponatremia, low sodium levels. If I don't drink enough water, I can cause deadly hypernatremia. But it's the same with sun exposure. You need to get a constant, low level, regular sun exposure where you don't burn yourself to a crisp, and you will be protected from several diseases that no one wants to get. And it's the ones that kill the most people, at least in the United States, as you can see by the CDC data. With that, I will continue on with this the next time, which is what are mitochondria. And we're going to go do some deep dives about mitochondria the next several webinars, or whatever we want to call these, the lectures or podcasts or whatever. I mean, it doesn't really matter what it's called. We're going to go through a deep dive of this thing, and we're going to tie it together pretty succinctly, how to remain in good health. And I think you can see today, I hope at least, that sun exposure is critical for that. I mean, those factors, as you can see on all of the graphs, are independent of diet, independent of weight, independent of a lot of factors. Those are just strictly UV exposure and distance from the equator, which is supposedly associated with increased UV exposure, which has all kinds of downstream benefits. So I hope this was helpful. I hope this was eye-opening. It was surely eye-opening for me. I mean, I definitely had a personal bias going into this, thinking that we were going to see, improved health with more sun exposure. But I certainly didn't think to see all of these pathologic conditions that I see in the hospital and the clinic on a day-to-day basis, be dramatically lowered, exponentially lowered in some cases, via more sun exposure. So I hope that makes you less scared. Be smart, go slow, build up a solar callus. We'll talk about that more in detail, how you do that. But get outside in the sun, because it's going to help you remain healthy. And with that, I will end this one, and until the next time.